I would like to welcome Dr. Herman Spies today. He is a functional medical doctor with a vast experience on how to integrate various different complementary medicines and modalities into an allopathic practice. Welcome.
Thank you very much, Daleen.
I would like to just ask about you and how you ended up in the position where you're practicing integrative and functional medicine with all different equipment and tools that you use in your arsenal.
I started off as a medical doctor, and I think like most people in natural medicine, we must have had a personal experience somewhere along the line. So mine was my daughter. She was born with severe colic, screaming from literally 5 o'clock in the morning till 11, 12 o'clock at night, and then passing out. And she had reason to scream because for a tummy to work, we had to literally manually help a tummy.
Okay.
We took her from all my specialist friends, one after another, and nobody could help her. And every time my wife came home, I said to her, "So what do they say?" And she said, "No, they said your diagnosis is right. She's got severe colic." And then I said to her, "So, okay, what did they give?" And she always said, "No, they wanted to give me a prescription, but we've already have got everything in the cupboard." And I was desperate because I knew the screaming wasn't going to stop. And then one day she said to me, "Why don't we go to Dr. Louis?" Now, she was referring to Dr. Louis Potgieter, who was somebody I knew as a small boy. And I phoned him up and I said, "Dr. Potgieter, would you like to look at my girl?" He said, "It's fine." So we drove the day to Houghton, and we were sitting in his office chatting. We haven't seen each other for 13 years, and I just heard my wife walking outside in Houghton with all the roofs lifting with this child. Not screaming, but I tell you, it was ear-piercing. And after we said our hellos, he just knocked on the window and he showed my wife come in. So my wife came in, and he took his little light and he looked into her one eye, and he looked into her other eye. It took him about 2.5 seconds, and he said, "This child has got reflex pancreatitis." Now, at that point in time, I was a medical doctor for 13 years. So I kind of looked at him in total disbelief. And he just burst out laughing, and he said to me, "Go get the bloody medicine and give it to this child." Now, we were so desperate because this has been going on for 8 months. Screaming for 8 months. And we were so desperate. When he said, "Go get the bloody medicine," we got into the car, went to Rosebank, Willita Pharmacy, and for the first time in my life, as a medical doctor, I bought homeopathic medicine. I was desperate. We started giving this child the homeopathic medicines. 3 days later, her tummy started working. 2 weeks later, for the first time in her life, at 8.5 months, I saw my baby girl smile.
Oh, wow.
And when I saw that, I said, if he can do it in 2.5 seconds, I want to do that too.
Sure.
And that's where everything started.
Wow.
So then he became my mentor, and I said to him, "So where do we start?" And he said, "Well, at least you first need to know what's wrong with your patient." So he lent me all his thick German textbooks on iridology, and he said to me, "Start studying the eye, so at least you can see what's going on with your patient." So fortunately, I had a little bit of German at school, so it was tough.
I was going to ask you.
But we got
You didn't
there.
have Google Translate then?
No. And then I heard there was a course here in Cape Town on iridology, flew down to Cape Town.
Was that with Dr. Florrie Kirschbaum?
Dr.
She's
Florrie,
amazing.
yes, did a course. And then I had an idea what was going on with my patients. So I went back to Dr. Louis and I said, "I did this course." And he said, "Fantastic, now you need medicines to help your patients." So he introduced me to a homotoxicology course from Heal in Germany.
Right.
Started learning about these medicines I knew nothing about. And we started seeing progress.
Now, homotoxicology sees homeopathy, but it also sees conventional medicine and meets in the middle.
It's a bridging course to teach medical doctors like myself to start using natural medicines. And he became my mentor, and I can tell you, I think I must have driven him mad, because every time I saw a new patient in my practice, I said to the patient, or returning patient, I said to them, "Okay, we've tried the other stuff. Are you happy with the results?" And if they said, maybe not 100%, then I said, "Would you like to try something else?"
This is just so valuable, because I think at the time when I started reporting and writing and researching on natural medicine, the most difficult thing doctors faced is how do they make the switch from an allopathic practice and using natural products and becoming a homeopath, because they would lose their patients.
Yes. It was tough, I can tell you, I started off as a medical doctor with 100% conventional medicines. And then I started with this other thing in my practice. So the patients got to choose. So initially I had a conventional practice, then I had a choose practice. So the patient had the choice, natural medicine, conventional medicine. And things started progressing to the point that eventually we got to the point that if a patient came to me and he said, I want conventional medicine, then I said, you know what, I'm not comfortable using those medicines anymore. Would you like me to refer you to one of my colleagues? So it was a gradual process, and I think that process took about a year and a half in my practice. Then I totally switched to natural medicines.
Do you ever prescribe conventional medicines, Doc?
Of course I do.
Okay, and I just wanted to check.
I'll tell you, in my practice, I do use, if I had to guess, about 2-3 courses of antibiotics per year.
Oh my word.
But we always start with the natural medicines, and we've got so many other things that can help support the patient to heal naturally.
You would, for example, look at ozone when you're getting a superbug and not another course of antibiotics.
Absolutely.
Great.
We use ozone, we support the gut flora, we've got Rife resonance treatments that we use in the practice. So what we do is we support the body in a natural way, but if we find the patient's immune system is just so weak, with all the additional help and support we give them, they can't cope, then of course we put the patient on an antibiotic and we help them.
Sure.
So we know that causes trouble, but then afterwards we go back and we try and restore the gut flora as much as we can possibly do so.